First and foremost, I believe exercise is the most paramount to health. We do know that as people are more active, you feel good, you look good. It's a self-fulfilling prophecy. One of my concerns with CrossFit is that it really stresses personal best. So it's really important that you start off with a trainer, you start off working up your weights, and you do what's comfortable for you. Then if you're trying to achieve your personal best, your body's conditioned for that.
A lot of times, especially new athletes or clients tend to develop a little bit of a tendonitis or overuse. So the wrist wraps are nice, especially in the beginning. They provide a little bit of support. It just keeps from any inflammation, and also you're not going to see too much hyperextension or unneeded range of motion that can lead to an injury. Here we have the cloth wrap. They are not elastic, so they're going to hold a little bit better. They're not going to loosen as much throughout the process of your lifting and your working out. Here we have the elastic wrap, which is going to be a little bit better for low rep, heavier lifts. The cloth wraps are going to be a little bit better through more of a high repetition workout where you're constantly moving and they're kind of adjustable pretty fast on the fly. The nice other benefit of the cloth wrap is they're easily washable. You're going to start by holding one end of the wrap and then overlapping a circular motion around your wrist. The tighter you pull it, the less range of motion you're going to have, but you're also going to have a little bit more support. The looser the wrist strap, a little bit less support, but a little bit more range of motion, depending on how much you're lifting or how much support you really need for that wrist.
I think the most important thing that we can provide for CrossFit athletes is early diagnosis. If you hurt your wrist, and let's say you have what we call an extension motion where both your wrist goes back and you chronically have pain, there are two things that need to be addressed sooner than later. One is a scapholunate ligament tear, and the other one is a scaphoid fracture. If you feel your wrist, there's a little bump. This is called Lister's tubercle, and as you go a little bit farther out towards your fingertips, you fall into a little soft spot, and that soft spot is what we call your scapholunate ligament. Another place that can be injured that needs to be addressed early is a scaphoid fracture. Usually it's in this what we call the snuff box, and that area is pretty tender to palpation. They often present with just pain and swelling on the wrist and difficulties bringing your wrist back. The problem with both of them is that if they're not addressed and treated properly, it can lead to long-term sequelae as chronic wrist arthritis, and that is a big deal. One of the great assets of Arizona Bone and Joint Specialists is we have on-site physical therapy. We cover every single body part that possibly could be injured in CrossFit. And so we can really treat you and have good communication.